Hello and welcome to the 7th CTIS walk-in clinic. My name is Roxana Spulber and I am a change management officer at EMA. Let me start with some housekeeping rules. We will be using Slido to collect questions. We have opened the Q&A channel 2 weeks prior to the start of the event, and this new approach will continue for the remainder of the 2022 walk-in clinic sessions. Here's how to use Slido. Go to slido.do and enter the code on the screen, walk-in 7, or scan the QR code on the screen. Both the code and the QR code will be visible on all the presented slides for ease of access. You can ask your questions here and give a thumbs up to any question you want to see answered. We will answer the most popular questions first, so please ensure to use the thumbs up feature. Please keep the questions focused on CTIS functionalities. If the video is blurry or difficult to see, please read the instructions in the gray box underneath the video on the event page. There you can find a link to watch the live broadcast on full screen. In full screen mode, you can increase the video quality by clicking the HD button on the bottom right of the screen and choosing the 720p or the 1080p settings. I will now introduce some pieces of useful information related to CTIS before introducing the CTIS experts that will present today. CTIS allows sponsors to upload for publication and not for publication versions of certain documents, including the protocol and the investigator brochure. This functionality allows sponsors to protect personal data and commercially confidential information in CTIS by only providing such information in the not for publication versions of the document. To assist sponsors and authority users in fulfilling the transparency requirements set out in the clinical trials regulation, EMA is preparing a dedicated guidance on the protection of personal data and commercially confidential information in CTIS. EMA has published a draft of the guidance for an open consultation to allow for wider stakeholder input and to account for experience gained in working with CTIS. The draft guidance and the details on how to provide feedback can be found on the CTIS training and support page. The deadline to comment is 8 September 2022. A stakeholder workshop will be held during the public consultation period. Further details will be shared in the Clinical Trials Highlights newsletter when available. For more information on CTIS, you can consult various resources, some of them listed on this slide. The CT Highlights newsletter, the training and support page, and for guidance on CTR interpretation, you can consult Udralex Volume 10. I would now like to introduce our speakers for today. We have Laura Piopo, Scientific Administrator and CTIS expert, that has been working on the development of the clinical trial information system since 2017. And Ana Rodriguez Sanchez Beato, our CTIS Deputy Program Manager, that has been also involved in the implementation of the clinical trial regulation and the development of CTIS, providing a business perspective. I am now handing it over to our experts.
Thank you very much, Roxana, for the kind introduction, and good afternoon, everyone. Welcome to the walk-in clinic event. So I think we have received some questions already in advance. Roxana, will you share the screen, and then Anna and myself, we can go through the questions and provide some feedback.
Sure. Probably you will see on the screen in a few seconds.
We can see now.
Yes. So the first question that we have is, what kind of agreement needs to be obtained in order to disable the winter clock stop? This needs to be requested outside CTS before the application, or can it be requested with the application? Is agreement needed from all member states or just reporting member states?
Thank you. And maybe I can start with this one, and I don't know if Anna then would like to complement further. So colleagues, when we talk about winter clock stop, we refer to the functionality that is implemented in the system to pause any type of activities during the winter period between the 23rd of December until the 7th of January. And the intention of the reason why we have the winter clock stop implemented is because of the holidays period, and to pause basically the assessment and any possible RFIs that can be raised to the sponsor, and responses to be provided. I think there was also another question, actually is the third one that we see on the screen about the clock stop. So basically everything stops during that time. The winter clock stop is something that is currently implemented by default in the system, but it's true that would require an agreement or at least a discussion between the sponsors and the member states. So it's a kind of really discussion between the authorities, also including that this is the default setting that we have in CTIS. So our feedback would be considering that is something that would be applicable in 4 months, so not now, it's more for the December period, to approach the authorities and discuss this aspect with them. But the functionality is already implemented by default, basically to have it enabled. And in that period of time, then no RFIs can be raised, no conclusion or a decision can be issued. It's like freezing, let's say, the workflow for that time. It's important to refer to the list of national contact points. You might already know this list, or you are familiar with this list. Is available on UDRALEX Volume 10, the website maintained by the European Commission, and there you have the national contact points for all the NCAs. So for questions like this on the assessment and the clock stop, we also advise you to contact directly the regulatory authorities.
Thank you, Laura. The second question is, many clinical trials in the EU, example in Poland and Germany, are not listed in the national business registries, making OMS registration impossible. What is the workaround that sponsors should apply, and when will a solution be available?
Okay, thank you, Rosanna. I think for this question, I mean, just to let you know that we know about this concern, and we are working internally to find a solution. It's not an easy solution because we have to decide if this is something that we can address in OMS, which in principle it's out of that the organization management system, or if it's something that we should manage in CTIS, will require a change on the system. So we are still looking at this, what would be the best solution to address this issue, but please be aware it's in the radar, but we need to find what would be the best and the most efficient solution for this. So we are not, we have not forgotten this concern, and we are working on that. But I cannot give you a date when this will be solved.
Thank you, Anna. Can we consider this?
I think, yes, this was
reply
mostly related with the first question. Thank you, Roxana.
Okay.
I think we can close this one.
Okay, so initial CTA submission, including part 1 and 2. RFIs raised on part 1, leading to the update of the protocol, which will then impact the ICFs. How should the updated ICF submission be handled to ensure initial approval covers aligned to protocol and ICF?
Yes, no, that's a very practical and a good question. So the only way for the sponsor to update the dossier in the part 1 or the part 2 after the submission of the initial application is if there is an RFI raised by the member states. So if the RMS would create or raise an RFI requiring the update of the protocol, and this would trigger then modification or changes in the part 2 documents like the ICF, This can only be done in the system if also the member states concerned would raise an RFI for part 2. Every RFI is a section, let's say, specific. So if there is an RFI in part 1, you can modify the documents in part 1. If there is an RFI in part 2 raised by the various member states concerned, you can simultaneously update the dossier for the part 2. But you can only do that if you have the part 2 in scope. So either an RFI part 1 and part 2 is raised, or the part 2 RFIs are raised by the member states concerned. But there is no other way for the sponsor to update the documents while the application is under evaluation. And I think related to this, there was maybe another question. We will find it while we scroll, but I can already mention it here, that of course if we have conclusions already recorded in the system for part 1 or part 2, then an RFI cannot be raised after the conclusions on part 1 are documented by the RMS, or the conclusions for part 2 are documented by the member states concerned. So there needs to be a synchronization and an alignment on the RFIs being raised and being addressed by the sponsors, because when the member states conclude on part 2, they cannot raise an RFI then to update the documents in part 2. So that's why the two assessment most of the cases with a full initial application would go in parallel.
Thank you, Laura. The next question is also related to OMS. So it is not possible to register sites in OMS that are private practices in Germany, even if registration of the sites can be requested via CTIS. I assume that the sites will be rejected again, correct? How can the sites be submitted in CTIS?
I think this question is in some way linked to the previous one, but I don't remember now the wording of the previous one, and perhaps I missed to complement that question before. There are one thing that we plan to implement in CTIS is to, at least for investigational sites and also in other specific areas of the system, like their country sites, etc., is to switch off the submission of the information in CTIS. So currently you can log in CTIS and you can, if you can search in OMS, if you don't find the investigational site in OMS, you can create that site in CTIS and submit that form to OMS for validation, and then you can proceed with the preparation of the application. So now what we plan to do is to switch off that connection with OMS. So in that sense, you will register your site in CTIS, and therefore you will not have problems anymore in the case this practice cannot be registered in OMS. However, this, for example, the switch off will not apply to the sponsor. So if you are going to create a clinical trial, as you know, you need to select the sponsor, and therefore this switch off will not, the information on the sponsor will always go to OMS. And here is where you may have issues as well. Well, at this time, at this point in time, there are problems because we haven't been done the switch off for the investigational site yet, and on top you have this problem about registration of a sponsor of certain private practices in OMS as well. But please be aware that in both cases we are working on that. We are trying to see how you can register private practices, and hopefully it can be done in OMS. And at the same time, we plan to switch off the submission of certain organizations to OMS, like for investigational site, third party, etc. But unfortunately, initially the plan was to have this done in August. But as you know, this is a new system. We are incidents are reported regularly, and we have to prioritize what are those that require immediate action, and therefore some of the plans require some replanning and postpone some issues to be addressed in a later phase. But both things I explained are in our radar and in principle are planned, but we cannot commit exactly when finally can be delivered.
Thank you, Anna. The next question is, for a recently submitted CTA, we received an RFI requesting to provide document with an overview for all participating sites. Why is this necessary when sites are already registered within CTIS in Part 2?
Thank you. No, this is another very practical question.
This meeting is being recorded.
That has been raised. Indeed, I mean, it would seem that there is no need because the authorities, they have access to the dossier and they can easily see navigating in the part 2 the list of the sites for the member states. So might be a training issue, a training step, a matter of being more familiar with the system functionalities and how this would be displayed. We know that during the assessment, the member states might have a reason for requesting documents, supporting documentation as part of the RFI process. And this can be one of them, but in principle it's true what is stated, that the information is already displayed in the system, so it might seem like a duplication. There might be a reason for the member states to have such a request. I think, as Anna was also saying, is a new system. We are all learning to use it from different angles, and maybe this type of request in the future will no longer be raised. However, should not be a critical, let's say, documentation to be provided, considering that the information is available from the structured data in part 2. So maybe it's to come back to the authorities and ask them to provide more clarification, or see with the time maybe this type of request will no longer be raised. Thank you, Roxana.
Thank you, Laura. Next question is, would it be possible to create an Excel report for all RFIs received?
I think for in the system for the clinical trials, you have the download functionality with you can download the different information in the system from the applications to notifications, summary of results. So you should go to indicate what you want to download. You have also to select a specific section if you want validation, assessment part 1, or if the question is more specifically when you are in the RFI, you can download. My understanding is that that is not possible, and perhaps Laura, you can help with that and reconfirm that that is the case. But you can use the download functionality, and from there you have different options on what type of documents you can download,
indeed.
and what section, and if you want structured data or you want documents. So and
the format is, Zana, you were saying PDF and XML. It is not possible for the time being to export with Excel. So these are the format that we have for the PDF and for the documents, of course, and also structured data in XML format. Excel may be something that will be implemented in the future, but when it comes to the RFIs and the content of the dossier is not supported for the time being, as you were saying.
Thank you both. In case the test product and placebo are described in the same IMPD, is a separate IMPD for placebo still needed, or is it sufficient to upload a placeholder referring to the IMPD in the test product section?
Yes, for this, basically what is possible is for the sponsor user to populate a free text that we have implemented in CTIS, a justification field, where the user can basically mention that the IMPD is either the same document is provided or there is reference to the same documents already available in the system. So it's possible basically to cross-refer. That's what I'm saying, to the same documentation available for the test product.
Thank you, Laura.
Maybe I can take the next one as well, Roxana, because I see that no, sorry, there was the following one on OMS, but now the order has changed. We take just to give to Anna then the floor for the OMS question, but you will moderate, Roxana. I think in the meantime, the number of thumb ups has changed and now the order is slightly different.
I can take this one. I can
Okay.
take this one.
So would it be possible to receive an email notification after an RFI has been set up by the RMS?
So the answer is not. So in the CTIS system, the only email that is sent out is when the role is assigned to a user. So, and this was an agreement when we start with the development of the system. It was considered that it would be very burdensome. Imagine organization dealing with many clinical trials, being bombarding with the inbox with many emails on top of other regular emails related to other activities. So it was agreed not to use emails and that's why we built the notice and alert system. We understand that for academic sponsor, small organization that they may deal with a few number of trial, it might be annoying because then it is implied to log in the system on a regular basis. But that's what was done, and in principle, there is no intention to change this.
Thank you, Anna. Now we have more of a comment regarding deferral information. We have experienced 5 times with different trials that the deferral information entered in CTIS has disappeared the next day.
Yes, I think this is probably already reflected in the list of known issues, and can maybe comment more on that. We know, or let's say we are aware that currently there are issues with the deferral, and this has also led to issues for the public website. I mean, I guess it maybe has been noticed that the public website is currently not available. Basically, we're working on the deferral functionality, and this is one of the one issue that has already been reported, and we know is a concern, and we are working on it also because we have seen that it was having an impact on the publication part. I think you have seen it from our notice list of known issues that is published. So thank you for reporting this. I can only say that is, of course, a critical part of the implemented functionalities, and we're aware of it, and we are working on it. And I don't know if you would like to comment on the list of known issues in this regard. I think was already reported in the past.
I think probably for the next question, Roxana, it's more for Laura because I think it's related to the previous one's answer.
So does the evaluation of part 1 have any effect on the evaluation of part 2 for parallel submissions? Example, if part 2 is approved, but the protocol needs to be amended after assessment of part 1, can the ICF still be amended if necessary?
Yeah, okay, so this is really linked with what we were saying before in terms of modifying the dossier. So does the evaluation of part 1 have an effect on the evaluation of part 2 for parallel submission? If part 2 is approved, so I think what we mean is the conclusion on part 2 have been issued by the member states concerned, but the protocol needs to be amended, can the ICF still be amended? So, okay, the way it's phrased is basically on the point on how changes in part 1 and part 2 are connected. And this is linked to what I was explaining before. Updates of the protocol and in part 1 and updates of the ICF in part 2, in some cases might really go hand in hand. And the only way for the sponsors to modify the dossier is with an RFI. If we have part 2 approved, which is equivalent of having the conclusions recorded by the member states in the part 2, is no longer then possible for the sponsor to modify the ICF in part 2, because the dossier is closed. Once there are the conclusion, basically the member states have concluded on the content of the dossier at that point in time. So this brings us back to what we were saying before, that the changes in the dossier in part 1 and part 2 should be done with an RFI at the same time. If one part is approved or concluded it's not possible to modify the dossier for that section. I think this was the question that I was looking for related to the one that we have already addressed. Okay, I think we
Thank
can
you,
close
Laura.
it.
Thank you. Now we have a question regarding guidance on patient-facing documents. So when is the guidance on patient-facing documents be published? It was announced to be published at the beginning of August, but still no news.
Well, I have to say from my side,
Laura, you are on mute. Sorry.
From my side, I cannot answer this question. I don't know about this guidance on patient-facing documents. I don't know, Laura, if you have
No,
any
actually, I
information.
don't have also more details on what we mean on this guidance being announced to be published in August on patient-facing documents. The only guidance that we have now currently on public consultation, including is the one including protection of personal data and CCI that Roxana was mentioning. So sorry, maybe this question is not clear for both of us to which document you are referring to.
I think probably this relates to work that is undertaken by the Commission through the clinical trial expert group, like for example, advertising documents, and that I'm aware that there are certain documents that cannot be so are not explicitly indicated in the regulation, and therefore there are no placeholders for those documents. But this is not under the remit of EMEA, it's under the remit of the Commission to publish this advice on this document. I think it's part of the one of the Q&A, and I presume this is what you are referring to. But like, for example, videos related to advertising, recruitment, or things like that.
Thank you both. Now another question on OMS. Until OMS permits the registration of private medical practice clinics sole proprietor, may these sites instead be added to the cover letter? Will EMA inform member states of this current limitation on sponsors when adding sites in CTIS?
Okay, I will take this question. I think in general, member states, we have a group of member states that are informed on a regular basis, the same as we have a stakeholders group, and also we have another group of experts reduced to a certain number of member states. So they are aware of this limitation of the system, and this is why it's in our pipeline to be addressed as soon as possible. What I can ask you at this moment is to be patient. It's a new system. There are incidents. Sometimes we need to prioritize other things because my consent data breaches or legal issues. So, but we are aware of this, and we have it in our pipeline. We have the specification. It's a question just to find the right moment and to have this implemented. I don't think the solution is to put this in the cover letter, because the investigational side are structured data in the system, and at this moment you have still the option to follow the directive. That's why we have this transition period. In the meantime, we will try to address this as early as possible.
Thank you, Anna. When a technical issue in CTIS prevents a sponsor from performing a required action under the regulation, and the EMA help desk has no timeline for a resolution, how should the sponsor proceed? Should the RMS be provided with the ticket number?
Yes, so this could be an option basically to keep the dialogue open between the sponsors and the member states, and we have seen this in few cases. I would like to emphasize that we are really following the critical issues raised via the service desk with high priority. We have regular meetings to keep each other informed, and if there are technical issues that would prevent the sponsors or in some cases the member states to perform their action, in few cases the EMA has intervened and applied ad hoc fixes, let's say. Of course, we need to be aware of the issue that is raised via the service desk, but once it is raised, it's not like there is no really timeline for the solution. Let's say that the more critical items are really escalated internally, and we promptly have a look at it. So when we can, of course, we always trying to intervene on time to avoid the application being lapsed or the system going through the workflow and actions to occur when they're not supposed to occur, let's say. So this is to just mention the work that is done internally to follow the tickets that we receive with the help desk. To keep the RMS informed, I think is a good idea to keep the dialogue between the member states and the sponsors, even outside CTIS when there are critical issues to be addressed.
Great, thank you, Laura. I think your answer also relates to the third question that we see on the screen, the system-related errors, and how can sponsors deal with such case. I think
yeah, they are connected. They are connected, and please also raise all the issue via the service desk, because it's our way then to track the request and keep different teams informed on the status and the resolution. We have basically daily meetings with the technical team and with the business analyst, and we follow the tickets that are raised via the service desk. So that's the only way then to be in contact with us and for us to follow the issue internally.
Thank you. And I think this also applies to this one. The CTIS has not allowed us to submit a response to RFI. IT could not resolve it. Will this be looked into? And so
this is particularly, yes, an issue with the RFI. We have seen that because of some rules and in some particular cases, the sponsor basically was not able to update the dossier with the responses to an RFI. So what colleagues are now stating in this question and answer is that because this could not be fixed by the IT team to modify, manipulate the dossier, the sponsor had to upload the revised, updated documents into the responses to the RFI rather than modifying the dossier. And this is, of course, a temporary measure in order for the member states to have access to the documents, but of course is not the correct way, because in principle the sponsor should have updated the dossier. So it was kind of a workaround. This is between the tickets that we are discussing with the highest priority. All the changes through the RFIs have really, we're keeping an eye on it, because it's important that the sponsor is able to apply the modification so that whatever is published also in the public domain when available will be the latest version with the latest documents. So is in our radar, I would say, and the proposed solution from EMA was just to upload the documents in the placeholder for the RFI so that member states could also see the documents, although it's not the final step, because should be via the update of the dossier. Is a temporary measure.
Thank you, Laura, and thank you for your flexibility of taking 3 questions at a time. Let's move to the next question. So, non-substantial modification concerning the protocol. How to handle protocol non-substantial modification 81.9 in CTIS system does not allow to upload a new version of the protocol.
Okay, I think if then our advice is that you include this non-substantial modification as part of the next substantial modification. So you can include your substantial modification plus other non-substantial modification. I can clarify that when the system was built, there were a lot of discussion at the level of the commission, the clinical trial expert group, about what are the Article 81.9 non-substantial modifications versus other non-substantial modifications. So it took time to finalize their Q&A, and therefore on the final Q&A version, now we need to revise or improve the system to be aligned with the Q&A, and this is something again that is in the pipeline and on top of many other things, so it will have to be prioritized and implemented according with those priorities. So therefore, in the meantime, if that is not feasible, um, my advice is that perhaps you should liaise with the member states, and it's true that this is an Article 81.9, which is relevant and important. And perhaps if you have a close substantial modification to be submitted, you can add it as part of that, is what it occurs to me at this moment. But bear in mind that we plan to make some changes in relation to the non-SM to address the 81.9 non-substantial modification in the system in line with the requirements of the Q&A from the Commission.
Great. Thank you, Anam. Is EMA planning to release the member states concerned calendars to the sponsors? Sponsors have to plan their resources much in advance, and we can't wait only till submission to receive information on planned RFI dates or approval dates. In case of our latest submission, difference in timeline is 4 weeks.
I can start with this, but Anna, please help me if you have more info. So the member states calendars are provided by the member states to the EMA because we use them in the system to calculate the due dates for the task. So we have strict and clear rules for verifying for RMS selection which calendar is the longest calendar, that is the one with more bank holidays during the selected period. We also use the member states calendars for the Part 2 assessment. In terms of sharing this with the sponsors, I don't think we have discussed so far, but on the other side, I mean, this information is really to see when there are holidays in the various member states. So
Yeah,
Anna, maybe you want to
yeah,
jump
I think
in here.
we don't have in mind to make the publication of the calendar. These are the official calendar, and if I'm correct, these are published also by the Commission in their public journal, so official journal. So and this it comes from there. So we don't intend to publish the member state calendars. They are official calendars that contains the bank holidays of those member states. And as I said, it's my understanding that the Commission compile those calendar and make those public.
Yeah, I don't think there are really initiatives to further publish these calendars.
I can take also the next one because I prepared for this one before because it was in the order. So for the RFI, the number of days allocated, yes, I think the number of the maximum days for an RFI is as indicated in the regulation, and as you indicate in the question, is 12 days, and this is maximum 12 days. So if there is an ad hoc assessment consideration, it may occur that the member state, instead of 12 days, asks you to do it in 1 or 2 days. So, but the maximum will be always 12 days, regardless if there are many or one consideration. So this is set out in the regulation test.
Thank you, Anna. Now the next one is, could you clarify if we can parallel submit Part 2 packages for the Wave 2 sequential countries and substantial modification addition of sites together?
Okay, as I interpret this question, it means can I, as a sponsor, submit Part 2 packages for wave 2 sequential countries. I think the user here refers to addition of new member states concerned. So when you say sequential countries, I assume you would refer to an Article 14 that allows you to submit new member states concerned in parallel to some other SM with part 2 in scope to add new sites. This is how I read the question, and the answer is yes. So the limitation is with a substantial modification in having part 1 in the scope. Basically, if you have an SM with part 1 in the scope, it's not possible then to progress with the submission of other SM with part 1 or with part 2. But when we talk about submission of SM part 2 in some member states, this can be done in parallel with addition of new member states concern. If I understand the content of the question right, when the user refers to sequential countries. So the answer is yes.
Thank you. We are 5 minutes away from the closing of this event, so I suggest 2 more questions, and then we can do our closing remarks. The next, yeah.
I suggest that if Laura can take the first one because she already answered several on the clock stop, and I can take the other one.
Yeah, sure.
Perfect, Anna.
Could you please provide me with the winter clock stop period dates in CTIS? Would you please clarify will all the pending tasks be postponed after this period, or if the timelines of all pending tasks will continue during the winter clock stop?
Okay, so the dates are 23rd of December until 7th of January, if memory serves. I think one day more or less, but I think these are the dates, 23 of December until 7th of January. What happens during this time period? Everything freeze. So the task will not continue during the clock stop. So during this period, we pause the assessment, we pause the RFI's due dates. Basically, it's an acknowledgement of the fact that there are bank holidays in the member states and Christmas periods, and the assessment is put on hold. So I would say that the tasks are postponed after the period. So the calculation of the due dates basically continues after starting from the 8th of January.
Thank you, Laura. And the last question, if yeah.
I would prefer to take the one on the next one, because this was on the
This
top
one.
before. Yeah, the next one, yeah.
Okay. So, sorry, just a second. Okay. So would it be possible for a sponsor to know which ethic committees has been selected to evaluate the CTA? It would be very helpful if the sponsor can contact the ethics committee directly if any questions exist regarding an RFI. Example, in the case of an unclear RFI.
Well, I have to say that this has not been implemented in CTIS, because if you look at the regulation, even it's not mentioned as such ethics committees. It's talk about member state, and it leaves to the member state how they want to be organized to involve other organizations in the evaluation of the application. And this is the reason why this information at this moment is not there, and obviously it's not in the pipeline to have this implemented. I think there is a ticket that was requested by some member state to have the possibility to indicate the proposed member state by the sponsor. The proposed, yeah, the ethics committee that is proposed by the sponsor, if I remember well. But in any case, this has not been implemented because there is no legal requirement for this, and therefore our advice is that you liaise with the member state in advance to perhaps have an understanding on which could be the ethics committee when you submit the application, and on that basis you can liaise with an ethics committee outside the system if you need to have further clarification. in any case, as you know, in the system, there is an interaction and there is the possibility to send more than an RFI. So you can always, in your response to the RFI, you can always say, okay, we don't understand this, we need to know this or that, blah, blah, blah. And then the ethics committee, when they assess the response to the RFI, they can raise a second RFI where they can clarify more exactly what they are requesting. But currently it's not in CTIS, and I don't think this will be a priority at this moment.
Thank you, Anna. So this concludes the Q&A session, and we are back to the closing remarks. So thank you for attending the CTIS walk-in clinic. The post-event survey will be opened in a few seconds so that you can share your satisfaction with the event. Now you can provide your feedback in Slido. We will open for the next, as mentioned initially, the beginning of the event, we will open the Q&A channel prior to the start of the event from now on, and we will prioritize the questions received in advance. As mentioned, this new approach will continue for the remainder of the 2022 walk-in session. The recording of this event will be available on the EMA website following the event. You can sign up for the CT Highlights newsletter for information on when the videos are available. The questions that have been asked will be used as input to EMA training and support materials. And we would also like to remind you of some next events hosted by EMA on CTIS. On the 20th of September, we will have the next session of the CTIS walk-in clinic. More detail will be available on the EMA events page. On the 22nd of September, we will host the third session of the OMS troubleshooting event for CTIS users, where you can ask your questions regarding OMS-related issues. And on the 28th of September, we will host the next bite-sized talk on notification. So in September, there will be a full week of events related to CTIS and different functionalities. Again, thank you very much to you, the viewers, and also to our experts. Have a lovely day.